Millions of Americans, just like you and me, become eligible for Medicare each year, but many don't fully understand how it works or even what it is. With so many choices out there, it's easy to get lost in all the details, which we all know can be frustrating because after all, what's more important than making a good decision about your health care? This is where Wellcare can help. They're here to help you understand Medicare and find the plan that's right for you. When you're ready, your local representative can chat with you about your specific options, or you can attend a Medicare Advantage event right in your neighborhood. Feel free to give them a call for more details or to make an appointment. But for now, let's spend a few minutes on some of the basics. So what is Medicare? Simply put, it's a federal health insurance program. You're eligible if you or your spouse have worked for at least 10 years in a Medicare-covered job, you're 65 years or older, and a citizen or permanent resident of the United States. Medicare may also be available for people under 65 with certain disabilities or end-stage renal disease. Now let's take a look at the different parts of Medicare.
Part A, hospital coverage, helps cover inpatient hospital care and care in a skilled nursing facility, hospice, or home health care. Part B, medical coverage. This part helps cover doctor outpatient services and some outpatient prescription drugs. It may cover preventative services, and in many cases, you pay a monthly premium that is generally deducted from your Social Security check. Part C, Medicare Advantage plans. As an alternative to the original Medicare program offered by the federal government, this part provides the option to enroll in a Medicare Advantage plan offered by private companies. Part C covers the same services as Part A and B, and in some cases, prescription drug coverage, Part D, is included as well. Part D, prescription drug coverage. Part D ensures that all Medicare-eligible beneficiaries have access to coverage to help with the cost of a broad range of prescription drugs and provides the option to enroll in a drug plan offered by a private company. Prescription drug plans offered by private companies may require a monthly premium, but also provide more predictable costs for your medicines, lower deductibles, or lower costs for certain drugs. Beneficiaries who want Part D through a private plan must enroll themselves. If you wait too long to enroll in a private Part D plan, you could pay an increased premium, called a late enrollment penalty.
Well, those are the parts of Medicare. Let's talk about how Medicare plans work. If you're like me, your next question is, who's paying for this?
Just as with traditional insurance, Medicare health plans are administered through using monthly premiums and a cost-sharing approach. Plan premium. A plan premium is simply the amount you pay each month for your health insurance and/or prescription drug coverage. Cost sharing. This simply means that when health services are provided to you, your Medicare health plan pays a portion of the costs and you pay a portion. Co-payments. You pay a fixed fee for a specific service. For example, to see your primary care physician, you may have a $15 co-payment. Co-insurance. You pay a percentage of a fee for a specific service. For example, 20% of the cost to see a specialist. Deductibles. This means you pay for your services until you reach a specific dollar amount. Then your insurer starts paying some of the costs.
Hopefully by now, you're noticing that the Medicare program was designed to give you choices. And really, who doesn't like choices?
As a Medicare-eligible beneficiary, you could get only your health services through Original Medicare with the federal government as your insurer. Get your health services through the government and select a private prescription drug plan. Get your health services and prescription drug plan coverage through a private plan that offers both. Purchase supplemental plans from private insurance companies to cover the gaps in Original Medicare or Medicare Advantage plan.
Let's take a closer look at these options.
Original Medicare. If you don't select a Medicare Advantage plan, you'll be included in Original Medicare. This is a fee-for-service plan that covers many healthcare services and prescription drugs. You may go to any doctor or hospital that accepts Medicare. This is a cost-sharing plan. There are costs you must pay like co-insurance, co-pays, deductibles, and other gaps. Medicare supplement plans. This is simply health insurance sold by private insurance companies to fill the coverage gaps in original Medicare. Medicare prescription drug plans provides the option to enroll in a prescription drug plan offered by a private company like Wellcare. Medicare Advantage plans. Medicare offers individuals the option to receive coverage through a variety of private insurance companies. These options are part of Medicare Part C, which is also known as Medicare Advantage. These are health plan options approved by the federal government and run by companies like Wellcare. Generally, these private plans offer additional benefits, more predictable co-pays, or lower out-of-pocket costs than original Medicare. And in some areas, these plans may be available with no monthly plan premium, which means no more than you already pay for original Medicare.
It's really important to understand the differences between these types of plans. So be sure to ask your local WellCare representative how they can meet your needs. Now that you know more about the differences between original Medicare and Medicare Advantage, let's talk about how and when you can enroll in a Medicare Advantage plan.
A Medicare Advantage plan is for people who have Medicare Parts A and B, live in the plan's service area, and do not have end-stage renal disease. If you have end-stage renal disease, you can find more information about your Medicare options at www.medicare.gov.
So that was pretty simple. Now for the details on when you can join, switch, or leave a Medicare Advantage plan.
Annual enrollment period occurs between November 15th and December 31st each year. Coverage begins on January 1st of the following year. Open enrollment period occurs between January 1st and March 31st each year. You can change plans once during this period. Special enrollment period. In certain situations, you may be able to join, switch, or drop Medicare drug plans during a special enrollment period, such as moving outside the plan's service area, becoming eligible for both Medicare and Medicaid, becoming institutionalized, or qualifying for extra help from Medicare to pay for prescription drugs based on your yearly income and resources. When you age into Medicare, you have until 3 months after you turn 65 to make a decision about your Medicare healthcare coverage. If you become disabled, if you're under age 65, you may qualify for Medicare Part A if you have received Social Security disability benefits or Railroad Retirement Board disability benefits for 24 months. For more information, visit www.medicare.gov or call 1-800-633-4227 24 hours a day, 7 days a week. TTY 1-877-486-2048.
So who is Wellcare and what can they do for people with Medicare?
With over 25 years of experience delivering benefits to our members, Wellcare is a national leader in government-sponsored healthcare. Our mission is simple but important. We work each day to enhance our members' health and quality of life, and work with healthcare providers and government partners to provide quality, cost-effective healthcare solutions.
As one of the largest Medicare and Medicaid contractors in the country, Wellcare offers products and specialized programs that provide people with Medicare and Medicaid the health care they deserve.
Wellcare offers a variety of Medicare Advantage plans, Medicare Advantage plans with prescription drug coverage, prescription drug-only plans, and special needs plans. And each of our plans is designed with a level of personalization, always with you in mind.
To best serve their members, Wellcare partners with physicians, healthcare providers, and pharmacies nationwide. They work hard to deliver friendly customer service and help you get timely access to quality health care. Okay, now we know who Wellcare is, but you may be thinking, why should I choose a Wellcare health plan and what can they do for me?
With a Wellcare Advantage plan, you'll get more from the Medicare you've worked so hard for and paid into all these years. Whether you're looking for a Medicare Advantage plan with medical coverage only, a Medicare Advantage plan that includes drug coverage, or just a prescription drug plan.
Wellcare takes a lot of pride in getting you more value for your healthcare dollar. Depending on where you live, Wellcare may have plans with benefits that deliver in a variety of ways.
No or low monthly plan premiums, prescription drug coverage, no or low co-payments, dental, vision, and hearing coverage, keeping more money in your Social Security check each month. Wellcare's Health Stuff program, a regular allowance for healthcare items, fitness center membership, options to visit specialists outside the network, rides to your doctor, and a limit on your maximum out-of-pocket costs.
But you know, it takes more than just great benefits. Good health begins with good habits. That's why Wellcare believes in preventive care, like regular doctor visits, to proactively address your healthcare needs. Because Wellcare knows this approach is essential to a better quality of life, they've also included valuable extras to help you maintain a healthier lifestyle.
Health and wellness education, complementary and alternative medicine, vitamins and natural supplements, popular weight loss programs, healthy reading programs, and medical alert systems.
Wow, that really is a lot of good stuff. You may also be able to get extra help with some of your monthly Medicare costs. And once again, the folks at Wellcare are there to help.
If you have limited income or resources, you may qualify for extra help paying for prescription drug coverage and even other more traditional healthcare services. Your local Wellcare representative can help you find out if you're eligible for these additional federal and state assistance programs.
You've worked hard. You've earned this, haven't you? So what are you waiting for? It's your Medicare. Make the most of it. Call Wellcare today and start getting the Medicare you deserve.
To enroll or to learn more, call Wellcare at 1-877-228-3604, 24 hours a day, 7 days a week, or visit www.wellcareplan.com. TTY 1-877-247-6272 or call 1-800-MEDICARE, 1-800-633-4227, 24 hours a day, 7 days a week, or visit www.medicare.gov. TTY 1-877-486-2048.